Great. Well, welcome everybody. Thanks for being here. And my name's Brad Jacobs. Many of you know me, some of you don't, and look forward to talking tonight about men's health. We've got a range of topics to cover, and I think it'll be a lot of fun to sort of go through some of this. I think there's a range of different questions and needs that people have. So what I think I'm going to do is spend a bit of time going through the PowerPoint presentation that I have, the deck here, but there's a lot of topics we can talk about, and I encourage us to explore that together. So what I'd like you to do through the talk is go ahead and feel free to send questions through the Q&A option there, and that will allow us to Rick, who supports me on this, will sort of help me field some of these questions as we go through, and we can sort of address a lot of it on the back side of the talk. So hopefully we'll spend about 30-40 minutes talking, and we might do a little bit of experiential too during this, and then on the back side we can answer some questions that you guys have that either on topics I didn't cover, or on topics we did but you have questions about. So just by way of background, many of you know, but not all of you, I'm an integrated medicine doc, trained in internal medicine and integrated medicine, and I run a medical practice called Blue Wave Medicine. We're up here in the Bay Area with offices in the city and in Marin here at Cavallo Point Lodge. And I also work with the Academy for Integrative Health and Medicine, which is the National Medical Society for Integrated Medicine. So I'm board certified in integrated medicine, which is a relatively new board specialty as of 4 years ago. But we train through the academy, thousands of healthcare professionals. We have a fellowship for those that want to learn more and become, if you're an MD, become board certified in integrated medicine. And if you're not an MD, at least get an advanced level training in integrated medicine. So my approach tonight about men's health will be an integrative approach. And let me tell you what I mean about that. So an integrative approach really means that we're going to consider all options on the table. So it will be medications, supplements, lifestyle, and a range of different health disciplines, whether it be acupuncture, it could be body work, chiropractics, homeopathy. There's a range of things out there to talk about. Some work, some don't, depending on the situation, and et cetera. So we really entertain all that. So that's one piece, is sort of the therapeutic toolbox. The other piece is the diagnostic approach too. And again, so conventional, but as well as could be Ayurvedic perspective or Chinese medicine perspective or many others. And then it's really a shift about the relationship, much more thinking about caring for someone within the concept of an ecosystem where the client or patient's in the center. And I'm one spoke on that wheel, along with other providers, along with their loved ones and family and friends, and maybe advocates and navigators and other people that really make up that ecosystem to help people navigate through their life. And then they're really just to think about things, not only about from health, from a disease perspective, but really about optimizing your health, optimizing your vitality, your quality of life, and your longevity. So a lot of that is a big piece of what I do and what I'm interested in. And I think integrated medicine for most people are really focused towards that. A little bone to pick is integrated medicine is really only practiced by MDs because, or DOs, or nurse practitioners and physician assistants, because we're trained in conventional medicine and then also do either ourselves trained in other things or work within an ecosystem of other providers. There's a lot of other providers that aren't conventionally trained that say they're integrated medicine providers, but you can't really be a chiropractor and be trained in integrated medicine, for example, if you've never trained in conventional medicine. So just for what that's worth, that's something that I think it's worth noting. So let me share my slides. Just go ahead and do that, and give me one sec here while I get that going. All right. So hopefully you just see this as one single slide, not my presentation part. So What we're going to talk about tonight are hormones and vitality, prostate health, brain health, heart health, 6 pillars of healthy living. That's what I'm covering. Let me know if you're not seeing the whole slide. Sometimes you end up seeing the presentation view, and in which case I want to change that up for you guys. So just raise your hand if that's the case. Give me one sec here. All right, so you're seeing presentation view. Give me a sec. See if I can get this going. All right. So that's what we plan to cover. So let's talk about hormones first. Let me start with an example. So here's a 52-year-old executive, and they've got diabetes, they're overweight, they got high blood pressure. They come in complaining, look, I'm tired all the time now. I'm not sleeping great. And my erections aren't great. My urinary flow isn't really as good as it used to be, and I can't really exercise like I used to. And the typical question is like, can you check my testosterone? So what other tests can we do? What else should we be looking for? So if you look at this guy, his BMI is 32, so he's obese. 25 to 30 is considered overweight. 30 to 30 up really is obesity. BMI sometimes is misleading. I often do body composition testing where you can see someone's body fat and muscle mass. And the reason being, you want to push up people's muscle mass. That helps testosterone as well as many other things. And you want to decrease body fat. That's really the predictor of being, quote, obese. So if you take a college football player, and put them, do their height and weight, and you'll get a BMI, they'll be obese because there's so much muscle mass on them. And the way BMIs work, it's just a measurement of your height in relationship to your weight. But body composition testing accounts for that. So anyway, this person's obese. Triglycerides are off the charts. If you look at the traditional labs, they say less than 150 or so, but the truth is you want less than 100. Ideally, you want the HDL, the triglyceride ratio, to be less than 3. So ideally, you've got an HDL of 50 and your triglyceride.
Brad, I have you frozen.
Okay. I can hear you. Any better? Am I back? Or am I still frozen? How are we doing now?
Okay, we're back again. There was a service interruption, Brad, so we're back online.
Okay.
Let me check on our attendees, though. Hold on a second.
They're all saying it's all good, Rick. I think it might be on your side. So,
okay, thanks.
So C-reactive protein level in this guy is 4, which means it's elevated. So meaning they have increased rates of inflammation in their body. So C-reactive proteins, it's a sort of a poor man's view of looking at inflammation, but most docs don't test it. I highly recommend you guys look at it and have your docs test for it. Ideally less than 1. They say less than 3 is good, but ideally you're shooting for less than 1. This guy's fasting glucose is 138. Again, you want your fasting glucose less than 100. There's some great conversations talking about glucose and insulin. And the truth is you really want to be checking your insulin levels. Glucose is a poor man's view because your insulin levels can go up and up and up, and your glucose is still showing 100 for a lot of people. 101, 102, maybe even 98. And only once things go Richter, like the insulin level, the resistance gets so high that eventually it can't keep up with it anymore. And then you finally start to see a rise in the glucose levels. So hemoglobin A1C, as someone asked about, that's just a 3-month average of your glucose levels. And that's really helpful. But often, like I said, with glucose, fasting, it can be arbitrary. It might be high, it might be low. It could be arbitrary. You do it a few times at a fasting level. But what I do, and I recommend people do, is you do fasting insulin and fasting glucose. And then you take you slam yourself with 75 grams of sugar, typically in a big syrup. You could drink 1.5 Coca-Colas or something, or 16 ounces of apple juice. And then 2 hours later, check your insulin level and glucose again. In a research setting, they do it every 30 minutes, 1 hour. and then maybe 90 minutes, and then 120 minutes. But typically it's sufficient just go at 2 hours. And you want to see what happens to your insulin. So you'll see, I've seen this time and time again. Glucose is like 98 and then stays at 98 roughly. Insulin starts off at 15, which isn't too bad, maybe 10, even better, and then goes to 50 when you get slammed with sugar. The insulin level really rises up. And what that means is that your insulin receptors are getting more and more resistant to that insulin that's hitting the receptor. And so you need more and more of it. So that the beta cells in the pancreas are having to produce more and more insulin. It's sort of like going to rock concerts all year for your life. And now you can't hear the music. Your hearing goes down because your body attunes it and tunes it down from too much noise. And that's what happens to your receptors. So insulin sensitivity versus insulin resistance. Okay. So this guy's clearly insulin resistant. He probably has diabetes, but even if he didn't, even if his glucose was 100, given his BMI and his triglycerides, I guarantee he's got insulin resistance. We can talk more about that later, but I just want to give you an overview. Okay, so what happens to these guys? So lifestyle is a huge piece of the puzzle. Alcohol, also xenobiotics, which are sort of hormones out in the world that particularly in plastics, for example. Overheating your testicles, so wearing those tight underwear, not good for the testicles. Let them dangle, and reduce that belly if you see that gut on that guy. So if you're going to drink alcohol, I tell people, if you're worried about body composition and glucose and calories, you want to drink hard liquor, because 1 ounce of hard liquor has way less sugar and carbs and total calorie count than a 8 or 12 ounce beer or 8 ounces of 6 ounces of wine. So you're much better off drinking hard liquor. So just to look at a bit of the physiology or the biochemistry of this, you can see what's going on here. So you've got testosterone and you've got estrogen. Okay, so the bottom is estrone and estradiol. The primarily active one is estradiol, E2, but basically both of those are estrogen. And you can see as estradiol levels go up, you shift testosterone shifts from testosterone to estrogen, which results in a lower testosterone. So what can often happen here is you end up doing the shuttle and shifting where testosterone goes towards the androstenedione to the left there, and then becomes estrone and shifts back and forth between estrone and estradiol. So, or often what happens too is you can get the aromatase activity going on and you get testosterone going straight to estradiol. So both of these things, you end up with a shift of testosterone over to estrogen. And some men can get boobs from that. You can see you start to get bigger boob growth. And you can just see a slight feminization, which you see in men in general as we age into the 70s and 80s. We're more emotional. There's less hair. Our boobs tend to get a little bit bigger for some men. Our testicles shrink a little. That's all estrogenization. And with women, as they lose estrogen, they get more masculine. They get a little more hair, they get a little more testosterone as it becomes more predominant as they get older. So anyway, this is a bit of a sort of understanding, with a big take-home message being here that you get this shift from testosterone to estrogen, which often could be another reason why it results in low T. And if you have insulin resistance, this happens a lot more. You store insulin, and then you end up storing more estrogen in fat cells, and you end up shifting testosterone into estrogen. So body composition is a huge piece of this. So what else? What about the environment? So look at this. So 4 times more greater erection difficulties and reduced libido with folks that were highly exposed to BPA. This is in China. 7 times increased risk of ejaculation difficulties. So really, obviously, I hope everyone knows you don't microwave plastic, right? Put stuff in glass if you're going to put stuff in the microwave, not plastic, particularly 3, 6, and 7, and styrofoam, particularly bad. The 7-PLA one is made from corn husk, which is better. But ideally, you're using glass and storing stuff not in plastics, but in glass, particularly if you're cooking, microwaving, it's in glass. So this BPA exposure is one that's been looked at. And then just talking a bit about lifestyle. So, like this quote, it's important to state low testosterone was not a true deficiency state, rather a barometer of ill health. right? That's really a big take home message. You've got low testosterone, barometer of ill health for most people. Why is that? So this guy, you got 891 men, roughly 54 years of age. They have metabolic syndrome and low testosterone. They were put into 3 different groups. This is primarily actually looking at diabetes and the effect of lifestyle on glucose control. But they did a subgroup analysis looking at this at testosterone levels as well. But the big take home message on this study, when it was looking at diabetes risk, was that lifestyle was as good as metformin, if not better, actually, and blew out of the water, of course, placebo. So lifestyle was just the number one thing to prevent for the prevention of diabetes and insulin resistance. Then these guys looked at testosterone levels, and they found testosterone levels were increased by 15% with diet and exercise alone. No treatment. These guys were in the no. And then if this was in the group, the lifestyle group, when they looked at the metformin group, which did a lot better with their diabetes profile, their testosterone levels didn't improve. So you can see no change with treatment, or the placebo group. So it was the actual lifestyle piece that increased their testosterone levels. And at 12 months follow-up, the prevalence of low testosterone had been reduced by 46% in that group. So average weight loss in the lifestyle group, weight loss was 17 pounds. So clearly lifestyle is big. In this group, it was primarily around eating 5 servings of vegetables a day. And I'm just looking at another question that came up I'll address about testosterone levels. So 5 servings of vegetables a day. Often people say fruits and vegetables, but I'm not a huge fan of fruit because of the sugar level. So if you want a serving of fruit, fine. A serving is fine, which is basically, a fist worth. Primarily vegetables. And if you've listened to my other talks, you know that every serving of vegetable you eat reduces your risk, whether you go from 0 to 1 or 1 to 2 or 3 to 4, it reduces your risk by 6 to 8% for death across multiple outcomes: cancer, heart disease, infections, autoimmune conditions, across multiple outcomes. So it was exercise about 150 minutes a week, and not smoking was a big one as well, part of this lifestyle intervention group. So those 3 were the big interventions. All right, so lifestyle can clearly make a difference, is a potent one. That's one of the main ones I tell people. And I often do body composition because you can actually see people's body fat go down, and then therefore they're becoming more insulin sensitive. And you can see their muscle mass go up, which tells you more muscle mass, more testosterone. So a question was asked about testosterone levels, what's considered low. So I often look, there's total and free. So total, ideally you're shooting for 600 to 1,000, but really you want to look at the free, because that's a biologically active one. That's what's bioavailable. And then that one you're shooting for the 50 to 100 range, 50 to 90 typically is what you're shooting for. So what about, this is rare, primary hypogonadism, but toxins can affect the testicles, but alcohol being a toxin, and also heavy metals. So that's particularly worth looking at. And in that case, you would see the FSH and LH going up because it's primary. It's a primary issue. So FSH and LH are going up, trying to stimulate more testosterone production, but it's not happening because you're having a toxin to the testicles themselves is a primary cause. Pretty rare. So, acute orchitis is an acute thing. Testicular trauma, again, are acute. And so now what about if you're looking at other factors? So, it's interesting. Lifestyle, depression, mood can affect a lot. So being divorced, being unemployed, low income, these are all factors that lower testosterone. And much of that can be mental health related. Much of that can be, access to good, if it's low income, access to high quality food, and whether or not people are engaging in lifestyle. Multiple medications can actually, that's been seen as a risk factor. We talked about diabetes, metabolic syndrome, alcohol, obesity, kidney disease, cancer. These can all reduce testosterone levels. And medications, so steroids in particular can, because it shuts down that system. And it's also been seen in opioids and statins. So what kind of laboratory testing to think about? If morning free testosterone levels are low, some people can check an FSH and LH. I've rarely seen it actually been out of whack. I've rarely seen it elevated from heavy metals. And if it's low, super low, the FSH, LH in the setting of low testosterone, you could check a prolactin level to look at something in the brain. Is that the reason? In a morning cortisol level, is there a primary issue in the brain that's causing the problem? But I've actually never seen these. I've heard they have, in thousands of cases when I work with colleagues, we've seen these abnormalities, but they're quite rare. So again, we talked about fasting glucose, liver and kidney function. We want to check those for the reasons I said in the previous slide. And the sex hormone binding globulin, if that's elevated, then you expect a lower free testosterone. And what that means is sex hormone binding globulin. So this globulin binds the testosterone. Okay, it's a sex hormone binding globulin. It'll bind the testosterone. So of the total testosterone, it binds it up and makes it less biologically active, right? So that's why I just order total and free, because the free is the stuff that's not bound by the sex hormone binding globulin. If you're in a place where they don't have free, then you would order total, and then you'd ask the doctor to also order a sex hormone binding globulin. And if it's low, then you're like, oh, okay, I got a 900 testosterone, I got a low sex hormone binding globulin, I'm doing pretty good. If you've got a 600 testosterone and you got a super high sex hormone binding globulin, that tells you a lot of that 600, which is already on it's an okay level, but it's on the low end of that. Then you've got, and you have a high sex hormone binding globulin, then your biologically available testosterone is probably on the low end. Easy way to bypass all that thinking, because it's sort of loosey-goosey and it's more gestalt, and is to just be specific and get a free testosterone. Zinc levels, you need those for testosterone synthesis. TSH, if elevated, then that causes an elevation in the sex hormone binding globulin. So if you're doing the free, again, you don't need to worry about thyroid stimulating hormone to look at sex hormone binding globulin as a predictor of its levels. DHEA levels can be relevant too. Estradiol levels, sometimes some people like to order those to see how high those are in folks, because I mentioned earlier that you get that shift sometimes. And just to run through the medications you're taking. A couple questions that people asked. Do you ever see problems post-vasectomy with respect to testosterone? No. All that does is cut the line that allows the sperm to make its way out into the world. And so this won't affect testosterone levels. Yeah. So, and then the question about testosterone shots. So I'll address that in a moment. So let's talk about supplements that can lower aromatase levels. Now, if you just go back to the slide here. So if you lower aromatase levels, then you can then see that you'll get less of that shift of testosterone into estrogen, right? So lifestyle is by far the most potent one. Quercetin's been shown to be somewhat helpful. Grapeseed extract, resveratrol with grapeseed. Again, the pigments that we see in certain foods have certain biological activity. That's why it's good to eat a rainbow of vegetables, because each of those colors represent a different phytonutrient and have different implications. And here you have the grapeseed, the dark colored grapes and berries. Zinc, as I mentioned earlier, you can get that in foods and also get it as a supplement. In the setting of COVID, both quercetin and zinc have immune benefits, and I recommend taking those with respect to COVID prevention anyway, in case you're exposed. And then avoiding, saturated fats and dairy and red meat. That sort of relates to triglyceride levels and also overall health. We find that people that eat lots of saturated fat, dairy, red meat tend to have other factors that are not as healthy about them in general as a gestalt. And so that's really, I think, a surrogate marker. All right, so prostate testosterone shots. So so some people like shots. In general, in my experience, what I give to most of my patients is the topical that you put on your shoulder. I found that to be quite helpful for most people that have low levels of testosterone. That I really push all the other stuff we just discussed, and then add testosterone into it. Sometimes, testosterone helps It really gives them the boost they need. It can affect mood and depression. So what does testosterone do? I didn't really talk about that. It can affect mood, vitality, libido, sex drive, muscle mass. Sort of a vicious circle around muscle mass. The more testosterone you have, you can build more muscle mass. The more muscle mass you have, you increase your testosterone. It sort of works both ways. And then the supplements that I mentioned. And then, if that's insufficient and or people want to jumpstart, I do start people on testosterone. I typically do the topical, but people like the pellets or injections as well. You tend to get that big hit and then it's the slow drop. The nice thing about the daily use topically is that you're getting a sustained level throughout the day and throughout the month. That's my preference, but I have patients that prefer the shots as well. All right. So what about prostate health? So thinking about prostate cancer, there's a couple things to be thinking about here. So one is, low vitamin D, they see has been more, associated with more aggressive prostate cancer. Doesn't necessarily increase your risk of developing it, but if you do have it, it's more aggressive. And the other thing to keep in mind with vitamin D is we've seen this. It's interesting. Vitamin D shows up for a lot of different health issues. We see low vitamin D in depression. We see low vitamin D in back pain. We see low vitamin D in more aggressive COVID, which is a reason I suggest people take vitamin D supplementation or at least get their levels checked. Ideally, it's 40 to 60. And that is vitamin D3 when I speak of vitamin D. And then what else do we know for other risk factors for prostate cancer? High body mass index, so meaning people are obese, they're twice as likely to die from prostate cancer if you're obese, and you're more likely to have more aggressive disease. Elevated insulin-like growth factor, IGF, so IGF-1 in particular, so a higher risk of prostate cancer or more aggressive disease. So this goes back to the whole insulin sensitivity, insulin resistance conversation, right? So if you're insulin resistant, you're going to produce more insulin. How do you produce more insulin? Through insulin-like growth factor. So that's an important piece of the puzzle. So you really want to try and do all the lifestyle things we spoke about earlier in order to get that into a better place. So you can see here, for example, if you increase your carbohydrate intake, you increase your insulin release because you need insulin because carbohydrate converts to glucose. And then you need insulin to grab the glucose to bring it into cells because the glucose otherwise just floats around and can't nourish the body unless it has insulin. The insulin is the messenger that grabs onto it and brings it into the cell and says, here you go, cell, use this energy so you can make ATP and generate energy. So then what happens, you get increased levels of growth hormone and IGF, and then that leads to increased prostate cell growth. So you're more likely to get increased BPH, so BPH, enlarged prostate. And if you have prostate cancer, then it'll increase the prostate cancer cell growth as well in this setting of eating high carb diets, as well as all the other factors we talked about with respect to obesity. So this is the earlier conversation, just to follow up about insulin sensitivity and resistance. And what this means is I can do a blood test on you and see that your insulin level, let's say your fasting insulin level is 20 or even 30. Then I can tell you have insulin resistance. And even though your hemoglobin A1C, the hemoglobin A1C, which is a 3-month average of your glucose, is 5.2 or 5.4, which is quite good, I'm telling you that is baloney, that there's an iceberg underneath of insulin resistance. And a decade later, if you keep the same journey you're on, will be pre-diabetic or diabetic. And that's what this is really showing here, that really, as you have insulin resistance, which is sort of the blue, you can see this blue dotted line showing pancreas insulin production and insulin resistance. As that goes up, only decades later do you see the fasting glucose levels start going up when they finally, the beta cells fatigue out. And then what's happening though in the background, as his insulin levels are going up, you're starting to get atherosclerotic disease decades prior to the glucose levels going up, okay? So again, you really want to be ahead of the curve. Tell your doctors to order insulin. Why we don't order insulin on a regular basis is shocking to me. It's only done in research studies, unless you're sort of a thoughtful clinician. So how do we moderate? Like a lot of us don't want to be ketogenic, go on the ketogenic diet. So if you're going to eat your carbs, my only ask is eat it with some protein and fat. And here's why. This shows you what happens to your glucose level if you just eat some bread or you eat it with some almonds too. And you can see here that having almonds will modify it. Now, bread, assuming the bread has fiber in it, almonds have fiber too. Yeah, that's part of it, but also it has protein and fat. That protein and fat slows the absorption of the carbohydrate and conversion into glucose. So the other aspect to really be thinking about here is the highest omega-3 levels associated with a 40% reduction in mortality from prostate cancer. So increasing omega-3 either through eating fish, through taking a fish oil pill, is really a great way to increase your omega-3. So, and what I tell people in this setting is, hey, if you have prostate cancer or you're at risk for it, do all these things I'm talking about, including if you're going to have fish that's high in omega-3s, like salmon, for example, or herring or anchovies or sardines. And then the days you're not having fish, take an omega-3, take a fish oil pill. And then total fat and saturated fat is what we've seen here is a reduction in prostate cancer survival. So, and we've seen omega-3 have the opposite effect. So that hasn't been, I haven't seen follow-up studies on that. This data is somewhat old, but that's the latest of what we know, and it's worth continuing to look at. There is a study, the Ornish did that looked at this and looked at the genomic level for prostate cancer and found that in the setting of a vegan diet, they found reduction in cancer promoting genes and an increase in cancer prevention genes, really a genomic shift in the setting of a vegan diet. The China study in forks over knives, speaking of vegan diets, they talk about cancer risk, and they have found in the observational research that they've collected and documented that when you increase protein levels, you increase risk of cancer. This has been highly debated. The jury's still out, but it's definitely worth thinking about. My sort of gestalt on reading on this literature is that animal protein does increase risk of cancer. That's my read. Ketogenic diet done correctly actually is relatively benign compared to most diets. With that said, if you look at the China study in detail, pretty much any amount of protein is, for the most part, animal proteins, for the most part, increases risk. But most people, 30, 40, 50% of their diet is protein. So a true ketogenic diet, 70% of your diet is fat, only 20% is protein, and ideally most of that's not from animal product, and less than 10% is carbs. So for those that are pursuing that path. So I'm going to move through some of this with respect to prostate cancer. If you have questions, just let me know, just for the sake of time, and be respectful of that. And just to say here, this really is what I was speaking to earlier with Dean Ornish, who did a multidisciplinary study that involved group support, moderate exercise, yoga, and a vegan diet. And he found a reduction in PSA levels, as well as a genomic change looking at cancers. So what I was saying before about those that promote cancer versus those that are protective against cancer. The other thing, which is I love telling my friends and patients that are men and their spouses, is that the more ejaculations you have, you have reduced risk of developing prostate cancer. So good news for those that like to have sex. Regular sexual activity improves symptoms of chronic prostatitis. We think it reduces congestion. You get the flow out, you get the semen out, and volume of the prostatic secretions expelled with orgasm exceeds that obtained with a massage. So some people do prostatic massage, but actually the orgasm itself actually does a better job. At 21 ejaculations per month compared to those that have less than 7 per month. Those that did 27 or 21 or more a month had a third less risk of prostate cancer. So you can take that home if you're trying to increase your sexual activity in the bedroom. So, some of this is self-explanatory, really around sort of nutrition, but with specific thinking about prostate cancer with respect to cruciferous vegetables, which is true for multiple cancers, these cruciferous vegetables, non-fermented soy, green tea, lycopene, which can often come out of tomatoes, lignin-rich flaxseed, and avoiding dairy that has the BGH in it, growth hormone, trans fatty acids, obviously, which no one's really eating anymore, thankfully, and selenium. Usually no more than one Brazil nut per day, actually, because it has so much selenium in it. Exercise, some nuts, green tea extract, vitamin D, as we mentioned before, and potentially DIM, which relates to a product that comes out of cruciferous vegetables as well. And it's an indole product, and that you can do as an extract that's coming from cruciferous vegetables as well. So what about enlarged prostates? So we talked about, there's a range of options here. Lifestyle changes that we talked about earlier relating to testosterone and prostate cancer all also relate here. There's a range of different supplements that can be helpful. What's the problem with an enlarged prostate? There's no cancer risk. I mean, the question of increased cancer risk is sort of hotly debated. Some people study so yes, many studies have shown no. It doesn't increase your risk. But what happens is people tend to then have more frequent urinations. They get up at night multiple times, so they don't sleep as well. And that has its own deleterious effects when you don't have good quality sleep. And then often you get urgency. So like you used to be able to hold it for an hour before you need to go pee. But now if you have to go pee, you have to go suddenly. And then you get reduced flow. Sometimes people they pee in their underpants a little bit. They get leakage. So there's a range of stuff that can happen. So lifestyle, as I mentioned, supplements, these ones can be quite helpful. And then medications, alpha blockers as an example of them, can be quite helpful. Cialis has been used at a low dose on a daily basis and shown to reduce prostate cancer risk and reduce prostate size as well. And so that's really sort of the take-home message around those aspects around the prostate. So shifting gears a little bit, just to say that it's never too late to make these changes in our life. And if we're just focused for our own longevity as well as our quality of life, this is a great study where they took a whole bunch of folks, 45 to 65 years of age, 15,000 of them. And after 4 years, they found those that did the lifestyle intervention as listed here, which was similar to the one I mentioned earlier in the diabetes study, they were a third or more than a third less likely to be dead and or have a heart attack compared to those that didn't make the lifestyle changes. What was really interesting here is there was no difference between those that had always been living a healthy life and those that adopted it during this 4-year study. So I tell people, like, if I were God, or if we had an ear to God, I can just ask him, okay, tell me the day I'm supposed to die. I'll back it out 4 years, start my lifestyle change then, and then dodge that bullet. But sadly, and for better and worse, we'll never know that date in advance. So the sooner we can get on the program, the better. And really, much of this relates to our organs. So when you think about it, our heart health relates directly to our brain health and vice versa. So dementia, the main cause related to, for example, memory loss, it relates to atherosclerotic disease, right? We have our arterioles and arteries in our brain. We have it throughout our body, in our heart. We're all focused on heart disease, but we don't realize and don't appreciate that our penis, our heart, and brain, those all require clean, good blood flow. And without it, they don't work as well. So the erections aren't as good if your arterial supply isn't working as well into our penis. Same with our brain. Our thinking isn't as clear, or we have more memory lapses if we don't have clear pipes going into our brain as well as our heart. So they're all related, and we need to think of that as a holistic system, really. So thinking about lifestyle, I'll just run through what I call the 6 pillars of healthy living. We started, for those that are interested, we started a program both at Cavallo Point and which we're finalizing. We need to get sort of the Park Service approval and some other folks to allow us to do this, because in the setting of COVID. But currently at the Post Ranch, if those have never been there, it's an amazing spot in Big Sur up on the cliffs there, the Post Ranch Inn. We're running a 6 pillars of healthy living program there, where I give talks a couple times a week, and we have programming all throughout the day. And it's really built around these 6 pillars. And if you think about it, how do we stay active as we age? So we're shredding it. I just got out of the water surfing today. It was a great day at the beach. I still have some sunblock I think on my face. And we really want to stay active. If we don't use it, we'll lose it. So how do we stay active? And the sooner you can get started on the program, the better. And my real big take home message is you got to do a little bit every day. If you're the weekend warrior, particularly as you hit middle age, you're going to get injured more and more. You're much more likely. And the recovery time just gets longer and longer. So 10, 15 minutes a day, fantastic, and then you can build on it. Some days you want to do an hour, great. But if you just do an hour 2-3 times a week, you're going to start getting injured. You got to do a little bit every day, no matter what it is. And I love this picture, So, and I'll say one more thing about active living, which is there's actually 3 aspects of thinking about active living. So one is regular exercise every day, like I mentioned. 2 is the intensity doesn't have to be as big as you think it has to be. So you could do brisk walking, 15 minutes a day, fine. The 3rd is you got to get up regularly throughout the day. So what we've learned is that even with daily exercise, those people that sit on their butts all day, which is me included, if I'm seeing patients on Zoom or, particularly on Zoom, because when I'm seeing people live, I'm interacting with them. I stand up, I walk them out, I walk them in. There's like more interaction. I sit in front of a computer on Zoom. It's like you could sit there all day. You got to get up. So what I highly recommend people do is if you have a 30-minute meeting, you make it 25 minutes. If you have an hour meeting, you make them 50 minutes. There's a reason, because your brain needs a break and to reboot. And number 2, you need to get up and move around. So you got to get up, move around for a few minutes, and then sit back down. What happens when you don't do that is the blood stasis happens in the body. And you end up like in the lower extremities, you get blood stasis, you get swelling in the legs, you get varicose veins, you're more likely to clot, and then you're more likely to have increased inflammation, increased insulin levels, and a lot more clotting. This is all bad. So they've found that even those that exercise, if they're sitting all day, actually have worse outcomes. So please reprogram your day, put a little reminders, get up every 50 minutes or on the hour, 50 minutes, take a 5-10 minute break, move around, and then sit back down. Also, our joints. If we're sitting in one position, we don't feed the joints. When we're sitting in front of the computer, we don't do our normal breathing, which moves the lymph through our body and cleans out all the toxins and moves them through and out into the venous system, which then pushes them through the lung, and you can expire it. And then you can also throw it in the urine and the stool, so in our skin, which all expires our toxins. If we're not moving the system, it just collects and accumulates. So really important aspects at multiple levels. All right, so thinking about food, we already talked a lot about it, the color of the rainbow. I'm going to speak a little bit more about stress and stress management. And what I'd like us to do is spend a few minutes doing a little bit of movement. So I'll do that on the back end. What I want to speak to is really thinking about stress. So what happens when we have a lot of stress? For a lot of us, cortisol levels go up. You can see this graph on the left-hand side. In the morning, I'm highly stressed. My head's thinking. I'm thinking about a bunch of stuff I got to do. And, in the evening time before bed at night, you could see it's an upper range of normal there. And then over time, for some people, they burn out. And that's the bottom left graph. You can see they just can't mount the cortisol response that they need to anymore. On the right-hand side, you see these folks are actually in the optimal zone, right? So they're sort of in the places they need to be. It's normal to have higher levels in the morning, but you don't want it totally jamming high. And, there's the Sunday morning or Monday morning heart attack syndrome that we found in the 50s and 60s, and we've known ever since, which is, Sunday night, Monday morning, guys coming in with heart attacks. And now, back then, now it's guys and girls coming in with heart attacks because working, stress of the work week, right in the beginning, boom, cortisol levels goes up, sympathetic drive, people get heart attacks. So how do you learn to modulate that? And a lot of it has to do with moving and sitting meditation, contemplative practices, learning to be present, dropping into yourself, calming yourself, being mindful, using your breath. Prolonged stress eventually starts in sort of the energetic level, moves through neurotransmitters, hormones, and the range of these substances that move through our body, and eventually results in physical matter. This is a picture of a brain. This is a picture of someone's hippocampus. And what this shows is memory loss. So on the right-hand side, high levels of cortisol level, increased stress shows over decades, smaller hippocampus, increased memory loss. So to find that sort of optimal spot, we all love a certain amount of stress, you know, it's good for us, and it truly is. In the National Institute of Aging through the NIH, this is being studied, it's called hormesis, which is a mild amount of stress, you know, with Wim Hof and a lot of these other guys that will say, okay, jump in a cold plunge and do these, you know, breathing practices and do these sorts of things that stress the system a bit so that you actually get an advantage. The immune system will respond, your neurons will form new, you get neuroplasticity. That's where you want to get that sort of peak point where your biochemistry, your brain waves, your heart rate variability, all is in that optimal space. And for many of us, we overdo it. So to learn to find that peak spot. When I tell a lot of people, they talk to me, they're like, I'm a stressed guy. I don't want to just hang out and do nothing. I'll be bored. Yeah, it's not an on-off switch, it's a dimmer switch. And I encourage people to sort of really drop into that. So thinking about this, most people spend most of their life not in the present moment. So I guarantee that most of you have had about 20 to 30 thoughts in the course of this 40-minute conversation that we've had so far. And the reason that happens is that we're trained, there's something called the default mode network in our brain that has run these neural patterns in our brain from millennia. We've always been scouring and checking for safety. You know, is the lion coming? Is another tribe going to attack me? And that's this default mode network that's always running, checking for safety. We're not worried about that now, but our brain still operates that way. So unless we proactively, with intention, redesign how we allow our brain to operate, we will continue to be the blue line in this graph, which is after something happens, a challenge, we're still thinking about it and we're worried about it. And we're worried it's going to happen again. And we're planning for tomorrow. And it's 3 a.m. and we're lying in bed and we can't get back to sleep. The red guy, that challenge goes away and then they physiologically come back to the present moment. So that's what we're shooting for. If time permitted, we might do a little bit of movement on the backside of this, which will sort of do a bit of an explanation of experiential of what I'm talking about. Thinking about brain fitness, this is just a quick summary to say, hey, low dose aspirin for many of us, there's mixed conversations. It's gone back and forth. And lately, the latest is, oh, we don't think it's worth it. People are at increases risk of bleeding in the stomach, bleeding in the brain. I think for folks that are at risk for badness, that I think baby aspirin is actually worth doing, particularly for men. Women tend to be healthier until they're postmenopausal. So for men in particular, particularly with cancer, it's been shown to have quite a reduction in cancer risk for men over 40. If you have chronic herpes infection, I recommend herpes treatment for brain optimization because chronic inflammation from recurrent herpes infection has been shown to increase risk of memory loss. This all relates to sort of memory loss and optimized brain function. Omega-3s we've talked about earlier for other health issues, vitamin D, curcumin, which affects and a range of different pathways. I'm blanking on the pathways right now. N-kappa factor beta, as well as NRF2 is what I'm thinking of. So NRF2 in particular, which is a multi-pluripotent pathway. I'm a big fan of curcumin, which comes from turmeric. It should be either bound in lipids or coupled with black pepper. It increases the absorption by at least 2,000%. Glutathione, which comes in different formulations. The sulforaphane, which relates to broccoli, which is the cruciferous vegetables we talked about earlier, which relates to DIM as well, which we talked about earlier. CoQ10, paracetam, which is a medication you only can get out of Canada, hasn't been approved here through the FDA. But this is sort of beyond the lifestyle program, which honestly gets you 70, 80% of your benefit. If you want to sort of top it off with other factors, you could use things like this. Sleep is critical. I don't have quite enough time to talk through it, but part of the main piece with sleep that I found for 80% of the people, outside of chronic pain, previous trauma, psychological trauma, and prostate issues that make people get up and have to pee a lot, putting that aside, it's our minds. So this goes back to the stress and mental fitness piece we spoke to earlier, and I want to do a bit of movement amount. You know, in the setting of COVID, this is a huge conversation around relationships and how do you actually re-engage. There's so much loneliness now. You know, you can be alone and not be lonely, but you can also be alone and be lonely. You can actually be in crowds and feel lonely as well. So that loneliness factor is really important, how we overcome that, how we think about engaging with folks. You know, what I'd like to say to people is, think of something major happen in your life, positive or negative. What 4 people might you reach out to and contact? And ask you to reflect on that right now. Like, who are the 4 people you would reach out to? And then to think about when the last time you've reached out to them. You know, maybe during the time of COVID, you've actually been more proactive, yeah, hopefully, and reached out. But if you haven't, really give that some thought. You know, try and calendar some time, or you reach out to folks on a regular basis. You know, for my family, for example, none of them live in the Bay Area. If I'm in the car, that's my time to call the family. You know, call my mom, call my siblings, because that's my sort of cocoon time there. And you know, it's been more challenging now because I'm less in the car than I used to be. So if I'm on a walk or on a hike, but really just sort of carve out time. So let me, what I'd like to do is answer. If you guys have questions, feel free to throw them out there. What I'd like to do is a bit of an experiential. So I'd like to sort of get us up a little bit and do a little bit of movement. So let me just switch things here for a moment. Great. So if you can get up yourself, because I'd like you guys to experience this too, we'll do a little bit of Qigong practice to really get ourselves moving, get our energy movement happening. What I like about martial art or moving meditation practices, whether it be yoga or Qigong or Tai Chi or other martial art practices, is that it really involves the mind and the body and the breath. And in so doing, you're really handling multiple things at once. You're getting fitness as well as calming the mind and dropping yourself in the present moment. So let's do a bit of a practice here. We've got a few minutes left. So we'll just start off with a basic practice of just reaching up towards the sky and looking up towards the sky with our eyes. And then coming down and reaching down towards the ground. And as we reach down towards the ground, what I want you to do, it's a gathering that you're doing. So you're gathering and then you're coming back up again. And as you're coming up, you're breathing. As you come above your shoulders, you're going to breathe, you're going to actually exhale. So exhaling as you go above your shoulders, up to the sky, and then we come back down one more time. So we're coming down, gathering, you're breathing in as you're coming down and gathering, and you imagine you're collecting hot, warm sand that you're pouring onto your core being. As you move above your shoulders, you're expelling out dark, stagnant energy, thoughts, ideas, things you don't want anymore, they don't have use for. As you come down, you're gathering new ideas, new thoughts, new energy, Mother Earth's energy, human potential, all bringing into our core system. As we rise above our shoulders, above our head, into the sky, we're discarding the parts and things in us that we don't really have use for anymore. And so in so doing, we're making room to bring in good new energy, which were ideas, thoughts, potential. And then we'll do this a few more times. Exhaling, starting to breathe in here. Exhaling. We'll do 2 more of these, breathing in, gathering, exhaling out, and 1 more. And then we'll bring our legs together, bring our hands close to one another, just a little bit out, maybe 6 inches apart. Just do a bit of a standing meditation here. Shoulders are relaxed. Your eyes are sort of glancing over the top of your fingertips. Notice your breath. Notice your pelvis. Notice where you might be holding tension. And rubbing our hands together, generating some heat. And what we're going to do here is allow the energy in the palms of our hands, generating heat out of that part of our body, so coming out through the system in through the hands. Then we're going to cover our eyes and take a big breath in. From a Chinese medicine perspective, our eyes are the portals that come out of the liver. So the liver meridian exits through the eyes. So what we're going to do now, and from an emotional level, that's sort of decision-making, frustration, anger, all is related to the liver. So what we're going to do is a bit of a cleansing here. We're going to cover our eyes with our hands, and then we're going to breathe in and breathe that energy into our body. So cover your eyes, breathe in, and exhale, and then one more time. Cover our eyes, breathe in, exhale, and one final time. Cover your eyes, breathe in, and exhale. Great. Well, I think we came up upon the hour here, so I'll bring this evening to a close. If there are any final questions, you can feel free to shoot them out through the Q&A. We recorded this, so if you want to see it again or want to tell others about it, we'll put it on my YouTube channel, which is DrBrad Jacobs, Dr. Brad Jacobs. And thanks for coming. We do this once a month. We do on different topics each month, and look forward to talking more and engaging more. Thanks for your attention. Have a good night.